All right, so good afternoon, good afternoon, good afternoon. Thank you again for your patience and for staying with us this afternoon. We have a demonstration from Atrium. We have two individuals from Atrium Healthcare. We have Centario
Burns.
Burns,
Yes, sir.
and then we have Barbie Sprouse. Centario is he's the liaison between our virtual clinic and Atrium, so he'll be around making sure everything is set up right. Barbie is the medical assistant, is the certified medical assistant that basically, when we call the number, the concierge number that you call to schedule an appointment, she's going to be the person, and Myra is another individual. There'll be individuals who will meet us here to actually make sure that you have the services. So today, they're going to provide a demonstration on what the services will provide and what the services will look like as well. And they'll probably need a volunteer. So can I get a volunteer?
Anyone?
Anybody want to volunteer?
Okay.
Thank you, Ms. Jackie. So they'll call you down, I think, when they need you to volunteer. So, okay. All right, so I'm going to turn it over to them.
Awesome. Okay, I think I'm right up here. All right, good morning. Well, good afternoon, everyone. Again, my name is Centario Burns. I am the practice manager for our community virtual primary care, and I want to thank Mount Zion for welcoming us this morning. Generally, this presentation is done by our marketing strategist, Jeff Ross. Jeff was unable to join us this morning, so I'll do my best to fill those shoes this morning. The Atrium Health West area. So what is that? The Atrium Health West area, all of our Cleveland County and surrounding areas in the western part of western region of North Carolina. So that includes Gaston County as well as Lincoln, Cleveland County as well as Rutherford County. That totals up to about 500,000 of the population around this county and service area. So that is a huge population in this area. For Atrium Health, our goal is to seek to improve health, elevate hope, as well as advance healing for all, providing financial support to non-profits as well as volunteerism in our community health programs and other community benefits. So that is our Atrium Health mission statement. Who must we impact? Vulnerable communities are defined by two demographics. The first would be our racial minority groups, our Black, African American, Hispanic, Latino, or Native American, and as well as 300% of federal poverty. So persons in household, we're showing that the poverty level for one is 45,000, for two people 61,000, for three 77, as well for four 93. So within that, we're looking for an enterprise-wide strategy to allow us to target the most vulnerable people, as well as regardless of their zip code. Social vulnerability index by census tract, vulnerable populations and communities in need. We have our rural sections of western countries such as Shelby, our southwest and central Gastonia, rural sections of Anston County and Wadesboro, Monroe, South Boulevard Corridor, South Meck, as well as Rock Hill, South Carolina. Equity and access. I think that is one of the biggest things that we're preaching here. We do have sites here in Cleveland County as well as in Mecklenburg County. In Mecklenburg County, which is our Charlotte region, they may have more access points, things of that nature. So a lot of our big success we've had in some of our locations in Cleveland County, such as we have in Shelby, we have Mount Calvary Baptist Church, Mount Calvary that we have. We have Cleveland Community College. We have a few other community resources that we've currently implemented. So looking forward to adding that to Mount Zion here. So in the past, we were used to traditional healthcare clinics. You know, when we think of healthcare, we're thinking of you going into a physical location, a brick and mortar, or a doctor's office. We're thinking of traditional things, or you might go to the ER, urgent care, things of that nature. But in the future state, we are looking to redefine healthcare. So that's with physical clinics, mobile clinics, virtual care, as well as in-home healthcare.
Centario, can you speak to the mobile clinic that's at Washington Outreach? I think Jeff said Tuesdays.
That I want to say the
I think it's every Tuesday.
Tuesday. Which location? 'Cause, I think it's every Tuesday. 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 I think it's every Tu Would that be?
It's in Washington.
Okay. You want to speak on that? Probably?
We do have a mobile clinic that comes, and they offer primary care. If you don't have a primary doctor, you can actually have an in-person visit there, and they come to the Washington outreach a few times a week, and they provide more services as far as for primary care. So let's say you've got hypertension and you've not been able to get that under control, and for whatever reason your provider left the office, or you're just not happy at that location and you want to change to something different, this could be interim until you find another provider, or it could be your long-term provider. We also have virtual primary care, which is kind of like this. You can do a virtual visit at home with them, and they can send out if you need lab work, if you need x-rays, if you need any testing done. They do the same thing and send out referrals for that for you, so you can get the same services as if you were at a brick and mortar location.
Awesome. And also to help one of the persons that help us headline this big initiative is Dr. Patricia Gritton, who is our medical director for all of our virtual services. That includes virtual primary care as well as community virtual primary care. Access to medical care in our community, rhythm of life. So we're looking for the right care at the right time at the right place. So we're trying to expand that to other places. Like I said, we're thinking of your ER or your doctor's office. This is also a place that is the right place, right time, that you can also contact us with. Our current locations, we currently have 165 sites. That goes across the 2 states as well as 8 counties. And now we would like to call up our volunteer to do our mock demo.
I believe it was Miss Jackie.
Miss Jackie.
I'm going to turn on.
I need to reach out to Sarah.
I'm Barbie Sprouse. I am your telepresenter, and my partner, or my coworker that will be joining you at visits as well, her name is Myra. And we come here to this location. Let's say you want to make an appointment, you call that 844 number. They get you an appointment here at your time that better suits you. If you were to come here as a walk-in and didn't have an appointment, you can still call that number. They will call us and say, hey, you have a patient at Mount Zion that's need to be seen. If we're at another location seeing another patient, we'll say, okay, we can be there in 20 minutes or we can be there in 30 minutes, and they'll let you know, and then we will meet you here at that time. Connected just a minute ago. So what we do is, once you arrive, we take your vital signs, we take all your information, your medical history, we check that, allergies, just like if you went to your doctor. We get all that information, we put it in the system, and then what we do from there is let the provider know that you're ready, and we put it into the Tido Care app, and then the provider joins us virtually. And sometimes it takes a minute to load up. And so we have another coworker of ours that's going to be our provider today. She's in Charlotte. Her name is Sarah. So I've put it in the Tido. She will see that there is a patient waiting, and she will join the visit here shortly. And so what we do from that point is we use this device to be able to look in your ears, eyes, nose, and throat, look at your skin, do a complete visit, even though it's virtual. So they could be in Bora Bora and still be able to hear your heart and lungs and see inside your ear and say, okay, yeah, you've got an ear infection, we'll send in an antibiotic. There we go. And this is Miss Sarah. I'll let Tario hold that up so you can see what that looks like. And so the provider instructs us or picks what we do first. Let's say you're here for a sore throat. She'll let us know, okay, we'll look at the throat real quick. And then she'll turn on the camera. And let's see here. You might have to stay this way. Here we go. Now, the camera's on, and then this is for the throat exam. So if you'll tilt your head back a little bit, open big and wide, stick your tongue out and say, ah. Say, ah. Okay. And so we get a good picture in there of how the throat looks. And then this camera also, if you have a rash, the camera is a high resolution camera, so they can look at the skin and see any kind of rashes or lesions or anything that you might have. So it's still like going to your actual doctor visit. Let's see. All right. And there you can see inside the ear probably for the first time ever. And you have a perfect eardrum. And so that, they would also listen to the heart and lungs.
Okay. Oh, okay, gotcha.
And they can hear your heart and lungs. I don't know that we'll be able to hear in here. Take a deep breath. But she can hear on that end, and she can hear your lungs very well. They've been able to hear murmurs. They've been able to hear wheezing. They've detected pneumonia from the device. So they can hear, they say they can hear and see just about better than they can in an actual visit. And that's pretty much how the visit will go. It's very quick and easy. Yes, ma'am.
Okay, so as far as blood pressure, would you do that manually?
Yes, ma'am. It's a manual blood pressure. We check your blood pressure, your pulse ox, your temperature, and we get your weight. And we do all that because some medicines are weight-based, so we get an accurate weight at each visit. And then once you're complete with your visit, if you need a work note, we can write one then. The doctor sends in prescriptions electronically, so it goes straight to your pharmacy. And the visit's pretty quick. It's maybe 30 minutes, you're in and out. And instead of going and waiting an hour or so at your doctor's office around all the other sick people, this is a one-on-one visit for you, and it's a lot more private. Thank you, Miss Maggie. Thank you, Sarah.
Thank you, Sarah. All right, pretty cool. Okay, get the job done, all right? Okay, awesome.
Any questions?
Yes.
Yes.
When you come, do you need to bring your medicines or a list of the medications you might be taking?
That's a great question. That's always a amazing thing to bring with you, is at least a list. That way, because we do go over your medications and we can update it if needed and make sure everything's accurate in there, because there are medications that interact with each other. So let's say you have COVID, some medications for thyroid and stuff like that interact with that medication, so we would need to do either a different medication, or they would say hold your this medication for this many days while you're on that medication.
What are the hours?
We're 8 to 5. Our last appointment's at 4 o'clock.
Monday through Friday.
Oh, yeah, Monday through Friday. I'm sorry.
Also, there's no exchange of payment at
Correct.
this time. And so if you do have your primary care, whatever your primary care copay is, that's what it will be, and Atrium will bill you whatever the copay is. If you're uninsured, really, they're not going to turn anybody away. So if you're uninsured, there's some financial assistance you saw on the screen there to be able to assist as well. They'll figure out the payment on the back end and figure out what that payment will be. So don't think that just because a person doesn't have insurance that they're not going to see it.
Correct. And we don't take any payment at the time. So, if you're on hard times, you come see us and we're going to get you seen and get you taken care of, and then we can worry about a bill later, even if you may not even get a bill, depending on. Atrium does really well now about figuring things out before they even send a bill. So they go ahead and pre-calculate, and if you meet that need, they go ahead and recognize that and take care of things on the back end.
So I would say, again, spread the word, because this is the only virtual clinic community-wise in Kings Mountain. So we'll have people visit our church that's not members of our church. So this is not just for members of Mount Zion. This is for the entire Kings Mountain community. So make sure we spread the word. They do have virtual clinics within the elementary schools. Every elementary school in Cleveland County has a virtual clinic. This idea started in 17, I think around 17 at Graham Elementary School, and then it just kind of spread it throughout Cleveland County. So every elementary school has a virtual clinic for the children to be able to see, and the employees as well. I think Michelle went to one at North, and then there's a couple of middle schools with virtual clinics as well. But this is the only site in Kings Mountain. They have other sites at Cleveland Community College. We have a site there to serve our students, faculty, and staff. Shoal Creek has a site. Mount Calvary was mentioned, they have a site. And then Ellis Chapel has a site as well. So again, we're the only site that's currently in Kings Mountain, so make sure we get the word out.
Do the sites at the schools only see children, or do they see community?
The sites are only school only.
Yep, school
So
only.
it's only school only. So when you call the 888 number, it's going to ask you, they may ask you if you're a community or a school. So we're actually looking for a community site. And they're going to route you to the closest community site based on where you are. So if you're in Kings Mountain, they're going to route you to this site. But yeah, schools are only for school employees and students.
And we do see a vast array of things. So, it's trying to keep people out of urgent care and the hospitals for things that we could see here. Flu, COVID, strep, any kind of rashes. We do flu, COVID, and strep testing. We do urinalysis. So a lot of things we can do here to keep you out of the hospital and urgent care and maybe keep you from getting exposed to something else. The only thing we can't do is x-rays. So if you feel like you've broke your hand, then you're going to want to go to an urgent care or hospital, because we can't do the x-rays and splint you like you necessarily need. So stuff like that would be a little outside of our realm, but any other things we're quite able to see. Yes.
Yes, sir.
Have we already had
A couple of patients already
Yes, sir. We have.
come here.
Yes, sir.
Okay.
We had one come all the way from Vail. Yeah, she said it was actually closer to her than Shelby, so she came here. And then we had one come from South Carolina, from York, South Carolina.
Yep.
So it reaches many people. So if you call that number, it doesn't matter where you're at, they're going to send you to the closest location towards wherever you live. And let's say you come to church here, but you may live in Kingstown. There's a site there at the Kingstown Town Hall. We could see you there. So wherever, in your walk of life, wherever you are at that moment is where we'll come see you at.
Reverend Catherine was here, she would say, this is a partnership with Davidson Alumni Association. So it is a partnership.
So is it fair to say that this clinic is a better option than going to the emergency room sitting for 4 or 5 hours?
Absolutely.
Yes, absolutely.
Because we can get you
That's one
in.
of the big pluses, is you can come here,
Yes.
set an appointment, be seen the same afternoon in maybe a couple of hours from now. But when you get here, you guys are here
Right.
rather than going to the emergency room.
Absolutely.
and then they charge you.
A lot, yes, yes. Yes, and even if we're not here at the moment, like I said, you can call that number, and if we're, let's say at Mount Calvary, we can be here in maybe 20 minutes. If we don't have a patient at that time, we'll leave from there and come straight here to see you. So you could just either wait in the car or come back in 20 minutes. But we will meet you at your time of need and make sure we get you taken care of. And it's a lot quicker than having to sit and wait 6 hours at urgent care, 4 hours at the ER to get exposed to more than you probably went with. And then, yes, ma'am.
So to reiterate, the number to call is 844?
Yes. It's the 844 number. There's the,
I think we have some flyers too.
Okay. I was gonna say,
yeah,
I'll
there's
grab
some
it.
in the room
You
in
guys
there.
want that?
But you call that 844 number, and those ladies are awesome. They'll ask you all the questions and make sure they get you to the correct location. And if you specifically want to come here, you can tell them, I want to go to Mount Zion, and they'll put you in an appointment here.
And if you'll say that number before you finish, because this is going to be on our Facebook.
Okay? That number is,
844. Oh, who's taking? Someone taking it down? Oh,
is recording it.
okay. So the number for the number to contact and schedule an appointment will be 844-563-5268. Again, that's 844-563-5268.
And if you had today's bulletin, it's on the back of it as well.
Okay. Sure. Okay. Yes, ma'am. Would you like one? Yes, ma'am. Yes, ma'am. Yes, sir. Would you like a flyer? Okay. Would you like a flyer? Yes, sir.
Yeah.
You're welcome. Yes, ma'am.
Like I said, I'm gonna use my husband's example. He had pneumonia. We didn't know he had pneumonia at that time, and we went to the emergency room, and it was awful. You know, the wait time because
Yes.
he was when they triage you, the deal. If you don't have a head or a heart situation going on, you kind of just wait.
Right.
So could he have come if this was over? Could he have come here? Because once he got back there, they gave him all these IVs, and and I guess long and short of it.
Two of them.
If he was to come here and you saw that whatever you had here, you were going to need to send him somewhere, would you recommend him going somewhere?
Right, if once we get here, let's say he has pneumonia, but his oxygen saturation is perfectly fine. The provider can hear the pneumonia when she's listening, so they can still prescribe antibiotics for him to take at home. But if his oxygen saturation's a little on the soft side or kind of low, we would refer him out to the hospital to be treated better, because he's going to need, nebulizers or oxygen maybe, and they can get home health. If he would need long-term oxygen, they can get home health involved where they can send oxygen to the home, stuff of that nature. So we can, once you come in, if you're presenting well, we can see you here and get everything done. If to us it seems like, well, his oxygen saturation is low, he's having a hard time breathing, then we may very well send you to the hospital. Yes, ma'am.
It's here, and when y'all send to the hospital, you kind of get bumped up to the first in line, right?
Not necessarily. The hospital has we can call and let them know that you're on the way. And we'll definitely let them know that if you're having some respiratory distress issues. Luckily, the hospital is very close to here. We can let them know their oxygen saturation is low, they're having a little trouble breathing, we think there's pneumonia or CHF, or they've got something going on. And they will take that into consideration. I can't say that they will put you at the first of the list, but they will actually, what they do at the hospital is they do pull to full. So if they're not extremely busy, you'll go straight back anyway. But if they do have a waiting line, if your O2 sat is low, they will, if you have any kind of respiratory issues, they will pull you on back. Yes, ma'am. Sorry. Yes. Okay. Any other questions?
Any other Awesome. Well, wrap up, Dr. Mack. All good? Okay. Well, I want to thank everyone for taking the time to view our presentation and hear us out. Definitely look forward to this being a community resource. I hope to not see any of you in there often, but do look forward to it being utilized for those that do need. If you have any questions, definitely certainly call that number. Like Barbie said, Barbie and Myra, they should be on site pretty often. But just want to thank everyone for helping us put this collaboration together. Many thanks to Henry back there. He's been very helpful throughout the implementation of this process. And I hope everyone has a good Sunday and a good rest of next week.
Thank y'all so much.
Yes, sir.